Good afternoon, Minnesota. Today I'll be joined by Minnesota Department of Health Commissioner Jan Malcolm for a little bit more of an in-depth dive into some of the data. I first of all want to wish everyone welcome back from I'm sure a very unusual and a quiet Thanksgiving. I want to thank everyone who made that effort to socially distance, to stay with your family, to do what we've been asking to protect those frontline healthcare workers, as we knew in the midst of this it was going to be a pretty tough weekend, and the numbers seem to show that. And I want to, again, Commissioner Malcolm does a really good job of doing this, and I just want to reiterate. This data is important, and as the First Lady oftentimes tells me, and she was the assessment coordinator for District 77 in Mankato for a lot of years, data doesn't give you answers. Data allows you to ask the right questions to find the answers that you need. That's where the professionals come in. Data can show the direction that you're going. Data can show trends. And then what you end up doing with that and the actions that you take can influence the direction of that. And I think sometimes, again, with Commissioner Malcolm warning to us is that being caught in the data can dehumanize the people behind that data. And I also want to say we saw this weekend an unprecedented number, and I think for human beings, when you cross certain numbers, it does trigger things in you, especially when you're talking about deaths. So when we passed 100 deaths, 101 deaths for one day, it's very shocking to the system, and for each of those families who lost someone, bringing our total to over 3,500 families without loved ones there. You'll see today, and the Commissioner will talk about the death total to be 15. Now, the reason I bring that up is we're certainly grateful and glad that it's 86 less today, but there's a lot of things that go into that reporting, whether the medical examiner, when they report it, and what's happening. We certainly don't want to downplay when we're getting good information, but the thing I'd like to do, and I think the Commissioner and I will spend a little time on the Mondays going forward, since we're the middle of this spike, of doing a little bit more analysis around the data of what we're seeing, take some questions focusing on that, because I think it's really important. Again, Director Earsman and others have talked about that lag period and a 7-day rolling average to give you, just like anything, one moment in time or snapshot in time does not give you the broader picture, but it is very I think it's necessary for folks to see where things are going. Folks have become very sophisticated about following not just case count totals, but about following positivity rates. And then, of course, some of those indicators that, again, deaths being the most obvious, but hospitalizations being up. So what we're looking for is what happens, again, with that inevitable lag between a spike in cases, the following 2 weeks or so a spike in hospitalizations, and then the following 2 weeks a spike in deaths. Where are we at in that process? And again, if the direction is going from 5% positivity to 15% positivity, obviously that's going the wrong way. So what changes can we make to make it go the right way? If we can all agree upon, we would like to see less people getting this and less people in the hospital and fewer people dying from it. And that's been the process from the beginning, to make sure, one, we did not overwhelm the hospitals. Two is we had the personal protective equipment to treat people. Three is the most useful tool we have in terms of finding out where we're at is testing on a massive scale. And then what mitigation measures have we learned, whether it be masking, social distancing, hand washing, those things, to change that data. So I'm going to give some extended period of time here to Commissioner Malcolm. We'll answer some questions after that. To get into the deep dive on this, I would like to say this again, and I've often said this: you shouldn't be patted on the back for doing what you're supposed to do. But I would also say that need to recognize the Department of Health and the folks who put the data together. Minnesota has been consistently recognized as being the state with the best, most transparent, and most usable data as it deals with COVID-19 from third-party validators. And I've often said it, whether I stand here with emergency room folks, people who've experienced COVID, or Minnesota Department of Health, they're not here validating my position around COVID-19. I'm here to make sure the state is validating the science and the position that makes the biggest impact on lives to validate their position. And this data of being recognized by third party of being good data, now it doesn't necessarily mean that we've used the data to make all of the right decisions, because the data won't make those decisions for you, but it has given us an incredible chance, and I think in many cases we were able to use that and are able to use that data to make informed decisions to save lives and to preserve that, that hospital space. And so with that, Commissioner Malcolm.
Well, thank you, Governor. Good afternoon, everyone. Well, as the Governor said, this is just a chance, since it's been several days now since we have been together and talked about daily numbers, to take a little bit longer view and put those daily numbers in a trend context. And I think that's, as the Governor said, extremely important to understand where we are in the whole scope of the pandemic. This first, before I get into the cumulative results, just the last few days of data bear repeating. Over the Thanksgiving holiday weekend, we added a lot of new cases. On Friday, we released data from Wednesday, the day before the Thanksgiving break. 5,704 cases last Wednesday that were reported Friday. On Saturday, we reported 2 days worth of data together, from Thursday, the holiday, and Friday. So on Saturday, we reported 9,015 total cases from both Thursday and Friday. Then on Saturday's 8,946 new cases were announced on Sunday, and yesterday's 5,801 cases were announced this morning. So just kind of resetting the way we do that several days over the holiday need to be really seen together. So what that means is that our total number of COVID-19 cases in Minnesota since the start of the pandemic has now reached 318,763. And sadly, we have a new total of 3,521 deaths in Minnesota, which were up 15 from yesterday, as the Governor said, but we had a really startling one-day record of 101 deaths reported on Wednesday that we announced on Friday. And just as a reminder, the daily number of deaths that are reported to the health department each day is what we're reporting, which is not the same as the number of people that actually died on a particular day. Funeral homes and mortuaries, hospitals, et cetera, have 5 days to report a death to the health department, so it's not an instantaneous process. There have been a total of 16,791 patients hospitalized since the beginning of the pandemic in Minnesota. 3,779 have received intensive care. There are currently 1,840 people in Minnesota hospital beds with COVID-19. Of those, 392 are in intensive care. And these daily numbers really are important. We spend a lot of time talking about them, but as the Governor just laid out so very clearly, one day or even a couple days does not make a trend necessarily. We are continually looking at these numbers, digging into them, looking for signs, whether those are encouraging signs or concerning signs, but we really need to see sustained reductions in case growth and positivity rates to consider that whether the tide is really turning or not. Which brings us really to the focus for today's discussion. So we just want to put, again, this kind of complete picture of the course of the pandemic in front of you, rather than looking simply on what happened over the last 24 hours or the last several days. And it really is easy to get fixated on any one given day's numbers, whether that represents a big increase or a notable decrease. And it's certainly understandable, it's human nature for all of us to really, glom onto that daily data and look for significance in a given day's number, especially when it feels like it's progress, and we're also eager to see that. But we do need to put everything in the context of the longer-term trends. And I do know that 2020 feels for so many of us like it's been the longest year ever. but it's just so important to reiterate that this remains a very new virus. We're only 9 months from the day we first confirmed a case here in Minnesota. And while we've learned a lot, there is still much more to learn about how the virus acts, how it spreads, and how it affects people's bodies over time. Some of the best scientists in the world continue to add to our knowledge of the virus, and that impacts what we know about where we are in this curve. And as we've said before, just the fact of the incredible global collaboration among scientists is one of the really bright spots in this pandemic. But we are receiving and reporting to you, and as the governor said, he has put a real priority, and we are proud of the fact that we are very open with our data, and we try to turn around data as quickly as we can. But it's not complete data immediately. It takes time, of course, between the time that a person gets tested and the results to be reported back to them and to MDH, and then for our staff to go through quite an elaborate process of cleaning that data, of eliminating duplications in accounts, making other corrections, and to follow up with cases critically to fill in some of the information on exposures and the like, and whether people are in the hospital and where they are in the hospital and whether they're still in the hospital. There's just a lot of staff effort that goes behind these numbers. And I say all of that just to explain what the governor mentioned about the importance of what we refer to as the lag period, and why on the various charts and graphs that you see here, we have notes on the graphs or a gray area on the most recent part of the graph to indicate that lag period. It's also why it's so important to avoid reading too much into any one given day's data report without looking at the bigger picture. The more complete data that we have prior to the lag period is much more solid, much more complete information for us to work off of when making decisions about things we should do to try to further slow the spread of this disease. And again, while we're certainly looking for rays of light from recent days, and many folks have commented that it looks promising, that some of our rate of case growth, for example, and test positivity have looked like they're improving in recent days. And while we're grateful for every day that looks better, we do need to give it some time before we know whether we're really in a sustained trend or not. But when we look at the bigger picture, we really believe that we are still in a very serious point in the pandemic and a very pivotal point for where things go from here. We do continue to see still alarming rates of case growth and, most importantly, serious resulting illness, as COVID patients are taking up an ever-increasing percentage of our available hospital beds. It's so important that we all remain vigilant. So we've got some slides here to show some of the trends that I'm talking about, and I know if folks are watching from home, it may be hard to see some of these slides, but I just want you to be aware that they exist. All of this data comes from our State Health Department website, especially a weekly report that we update once a week and post there, and also the daily dashboards on the governor's state COVID-19 response website. So that's where all of this data is coming from. You can see all of it and much more there. So this first slide that I'm projecting shows the rapid case growth, particularly starting in October and accelerating. When you look at this graph over time, it's really pretty striking. You can see the fairly slow but steady growth we had in the spring and over most of the summer. Ideally, we would have seen more of a decline in the summer months than we did. We did see what turned out to be an awfully short respite. It was about 3 weeks when case rates were actually decreasing. But then we started sort of a slow, steady march back upwards through most of the summer, but it really started to accelerate around October. It was the last week of August when we first exceeded the previous peak that we saw in late May of over 5,000 cases in 1 week. After a brief decline, we then started increasing quickly and haven't come down since. For comparison, in the most recent week for which we have complete data, so that's the week before the lag period, that's the week of November 8th through the 14th, we had over 46,000 cases in that week. That is more than 9 times the previous peak that we saw in May, when 5,000 cases in a week seemed high to us. And now we're, of course, well beyond 5,000 cases in a day, most days. So that's, again, where this lag period and what's happening in the lag period, even though we're not counting it yet in the official statistics, also tells us something about where things are going. So when we look at that lag period, the time since the last full week of data, which, as I mentioned in these charts, is November 8th to the 14th, we also can see trends during that lag period. So that week after the high week in mid-November of so many cases, 46,000 cases in 1 week, we were already seeing more cases reported in the lag period than in the prior week. And that told us that things were clearly still going in the wrong direction, because things in the lag period never get better. They can only get worse as more data comes in. We went over the 300,000 case mark on this past weekend, and that took us over just over 2 weeks from when we hit 200,000 cases. That's pretty stunning. And sadly, it appears that we'll get to 400,000 cases in the next couple of weeks as well. And we've talked about this before too, but with so much more virus around, things that seemed relatively safe even in August or even in early October are much, much higher risk as we head now into December. But just like 1 day of data can't make us feel too comfortable, even 1 week of data can't get us feeling too comfortable either. Looking at the longer-term trends is really important to keep us on the path, or even when things begin to improve, so that we can be sure that we stay on that right path. And that's certainly been a lesson learned from other states and from our own experience over the months as well. We need to have this broader perspective in order to know with greater certainty whether what we're seeing is really a persistent decline after a peak, or whether, as we've seen before, it's more of a wave pattern with a temporary trough in between a series of waves. I actually heard Dr. Fauci commenting on some of the national news shows just this past weekend that he thinks we are likely to continue to see this wave pattern over the coming weeks and months, rather than one notable specific peak with a steady decline after that. The next picture is the test positivity rate, and this again is one of the most critical measures that we track. We're not just finding more cases because we're testing more. And the fact that we are testing so robustly is really one of the bright spots, I think, in the Minnesota response. But we're not just finding more cases because we're testing more. Again, it's just showing us how much more virus is really out there, and it's a lot. And the positivity rate is what really tells that story. And it's certainly true that we're also being much more proactive with our testing. We're going out and looking for people who may be carrying the virus, but though they have no symptoms. So not waiting for people to be ill before they get tested. And so that's certainly driving up the test numbers as well, and the case numbers. But if that's all we were seeing was more asymptomatic cases because of testing, we also would not be seeing the very sharp increases in hospitalizations and deaths, which we'll get to in a few moments. We've talked about this a lot, but with this test positivity rate, we also know that more and more people are being exposed through community spread. And when we talk about community spread, we mean cases that can't be linked to a specific source, to a facility or an event or a known personal contact. This also suggests that the virus is circulating more widely in the community and that there is increased risk in any gathering of people. The next picture shows how this has truly become a statewide phenomenon. This virus is in every single county, every corner of our state. And this clearly shows that the virus is no longer just affecting areas with larger cities. In fact, case growth rates in greater Minnesota continue to be higher than rates in the Twin Cities metro area. The darker colors that you see here on this map indicate a higher number of cases per population, per 10,000 people in this case. And as you can see, the progression over the last 5 weeks shows just that map filling in with darker and darker colors, greater and greater concentrations of number of cases per 10,000 people. More than a third of Minnesota counties have now had case rates of over 100 weekly cases per 10,000 people. We consider a high-risk threshold to be 10 weekly cases per 10,000 people. So more than a third of our counties are 10 times over what we would consider a high-risk threshold for rapid rate of growth. And many of our counties are even higher. It's awfully hard to keep the virus out of our schools or out of our long-term care facilities when there's so much virus all over our state. This next picture looks at patients admitted to the hospital. And what you see here is also a hospitalization rate. This chart is tracking new hospital admissions specifically for COVID on a population basis per 100,000 residents in this case. And this is a weekly 7-day rolling average picture. And the numbers of people being admitted to the hospital since mid-October is nearly tripled with COVID. And this is on top of, as we've talked about before, hospitals that were already running pretty close to capacity, not 100%, but hospitals typically run at 90% or so of capacity in our state. And so when there's this great increase in the number of Minnesotans needing hospitalization for COVID, that can have some really serious implications for the availability of hospital care for other critical issues as well. And the number of people being admitted for COVID is far overshadowing what we saw back in May. Weekly hospital and ICU admissions reached a new high in the week that we're talking about before the lag period, where there were 1,769 patients with a first hospitalization. That's a combined ICU and non-ICU. That was an almost 20% increase in 1 week. And we know that we're going to reach another new high in the data lag period, since the number of patients admitted to the hospital and ICU by their first date of admission is already higher than it was in that last week. And again, it's really not surprising to see hospitalization spiking, given what we've seen in our case numbers. And we sadly expect to see that that will continue. As the governor has said, we see the spike in hospitalizations typically 2 or 3, even 3 weeks after cases increase. COVID-19, as we know now, can be very serious, not only for those at greater risk and not only for those who end up in the hospital. Some people get through a course of illness with COVID with mild symptoms or even no symptoms that they recognize. But there are many who will need extra care for serious illness, and many having long-term health effects that are only now being appreciated. We know that we can never be sure of who will have among the more severe cases of this illness. It certainly is true that younger people and people with fewer underlying conditions have better odds for mild illness, but there are obviously, powerfully, sadly, exceptions to those statistics as well. And it's certainly important to remember that if any of us gets COVID and we don't get seriously ill, we can still pass it on to someone who does get really sick or possibly even die. And this transmission can happen even before we know we've got COVID. And that is one of the most important things that we've learned over the course of months. A much, much higher rate of transmission among asymptomatic people than we thought at the beginning. Now, all this means that dismissing the risks of COVID just because we may be young or in otherwise good health is a gamble that we and the people we love may end up regretting. Getting a handle on slowing the spread in the weeks between now and when safe and effective vaccines are available helps us protect our family, our friends, our neighbors from ending up in the hospital. And it helps protect our healthcare workers who need to be well in order to be there to care for those who need it. And more on that in just a minute as well. So looking at hospital capacity, this is what I mentioned about having a larger share of patients in the hospital needing from COVID is coming on top of an already quite full and busy hospital system. And as the percentage of patients with COVID increases for both ICU beds and non-ICU beds, we're seeing that resulting in real capacity constraints and a lot of pressure on the healthcare system, as we've heard from leaders in recent days. At the beginning of November, the percentage of COVID-19 patients in ICU beds was 18% and 9% for non-ICU beds. And just as of yesterday, the percentage of COVID patients in ICU beds was 35% and 25% for non-ICU beds. And so that really is putting pressure on other needed hospital care for car accidents, heart attacks, strokes, and other conditions. And we've heard from some of the physicians helping to manage patient flow in our hospitals that it's becoming more difficult and needing to move patients further and further away from their home to get the level of care that they need. But it's a good thing that they're working so hard to manage hospital capacity as a statewide resource. But many of them are at or almost at capacity recently. And that is an issue not only of beds available, but of the staff available to care for people in the beds. And this is a graph, or two graphs, that look at the rise in cases among healthcare workers. The blue bars represent workers who work only in acute care, and the green bar represents those workers who work in long-term care settings, some of whom also work in acute care settings. But you can just see there the rise in cases among healthcare workers, generally reflecting the same shape of a curve that we've seen with cases generally across the state. And it's significant because, as we've heard directly from the caregivers, as more and more people are getting sick and going to the hospital, we need those trained professionals there to care for them. And those healthcare facilities are struggling to maintain adequate staffing levels because their workers are also getting sick or exposed and having to stay out of work. And typically, and this is important, they're not getting sick or exposed because they work in healthcare. They're not getting COVID from their patients or from the residents in the facilities in which they work. That's true for the majority of cases, of healthcare worker cases, are traced back to exposures that happened in the community. In other words, neighbors, friends, family, other people that they have contact with outside of their time at work. And the high levels of the virus circulating everywhere in the state make that a higher and higher risk for our healthcare workers in their daily lives when they're out in the community, which is why, again, we need all of us to take steps to help reduce the spread so that we can help protect these critical healthcare workers and other critical service workers, as well as those who can become severely ill from COVID-19. The next picture looks at long-term care cases, and that has been an important subset of the cases, and certainly represents a disproportionate number of the hospitalizations and the deaths. As we've talked about before, long-term care represents a number of settings, not just nursing homes, and we'll come back to that in a few minutes. But we know that some of the most vulnerable people, the people who have the greatest risk of poor outcomes from COVID-19, live in these long-term congregate care facilities. And the people working in these facilities have done a truly remarkable job of putting practices in place to protect their residents and their staff from COVID-19. But the extremely high number of cases in communities is spilling into long-term care as well. You can see here on this graph, the green line represents all Minnesota cases, and the blue line represents the cases in long-term care. And I think it's pretty remarkable that even as the state numbers were exploding, the level of increase in long-term care remained more under control. However, that really has changed in recent weeks, and you can start to see the uptick in that dark blue line, which is concerning because this is a small and vulnerable population. So a larger number of cases in this population is of great concern. And compared to other states, however, Minnesota is doing better than many others, keeping long-term care residents safe from COVID-19. The most recent data from the Federal Centers for Medicare and Medicaid for the week of November 15th showed that Minnesota was 37th in resident cases per thousand and also deaths per thousand residents when compared to other states for nursing homes specifically. But as we've said, this is like building a flood wall. The wall only works as long as the water levels don't rise above it. And the water is rising to such a degree in our communities right now with the amount of COVID-19 spreading, and it is spilling into long-term care settings despite their best efforts to build up those flood walls. This next picture just breaks down a little further the fact that we're tracking cases among staff and among residents across these various settings, which again is more than just nursing homes. We're talking about nursing homes, assisted living facilities, group homes, and other communal living settings that have a healthcare component to them. And we see cases trending up when looking across all these different types of facilities in both staff and residents. Just as an example, as of November 29th, skilled nursing facilities or nursing homes had over 7,700 total resident cases and over 6,300 staff cases cumulatively. Assisted living facilities had over 4,200 resident cases and over 3,500 staff cases. Group homes had over 1,500 resident cases and 2,300 staff cases. So all of those different settings are reflected in these long-term care statistics, except for the specific nursing home comparison that I gave you just a few minutes ago. But this really significant increase here, the green lines representing staff and the blue lines representing residents. And you can see again the steepness of the rate of increase in the more recent weeks here among this critical sector. And finally, from the perspective of the data, what we are seeing in the number of Minnesotans losing their lives to this disease also follows pretty much the similar pattern, lagged by several weeks from the rising cases, as the governor has mentioned. Daily confirmed and probable deaths reached a new high of 346 the week ending November 21st, with an average of 49 confirmed deaths per day that week. And as mentioned, on November 27th, we reported over 101 new deaths for a single day for the first time. And that was the report on November 27th of data from Wednesday. And again, deaths can lag behind cases by 3 or even 4 weeks. So with the growth in cases that we've seen in recent weeks, it means we're likely to continue to see increased deaths in the coming weeks as well. Too many people have already lost a loved one through this pandemic, which is, again, why we're asking so much of our fellow Minnesotans right now, that it's so critical to avoid losing as many people as we can to this disease. So all of this leads us to say that we are in still a very critical spot in this pandemic in Minnesota. This is the worst spot we've been in, and that's what the data tells us. That we are certainly looking for signs of promise. We're certainly looking for evidence over the coming weeks that the 4-week pause that we're in now will have a sustainable impact on these numbers, but only to the extent that we keep working on this together. And of course, we know that COVID-19 is a major problem all across the country. Even so, the upper Midwest has been hit particularly hard in these recent weeks. And for quite a while, especially here in Minnesota, we were noticeably doing better than many other states. And unfortunately, that's now changed. The current increase in cases in Minnesota, the rate of case growth that we've talked about, means that Minnesota now has more cases per population than New York, Arizona, Texas, or Florida, other previous hotspots. We are a hotspot, as have been our neighbors for some weeks now, which is again why we've all been asked to be a part of the solution here by making some temporary sacrifices again, to forego holiday celebrations with people outside our households, to not gather with people in settings we love to visit. And we know that this is not easy, but it is so necessary for us to turn the tide and keep each other safe, and to take what might be temporary data trends and turn them into sustainable improvements. The data aren't going to stay moving in the right direction without continued vigilance on all of our parts. And one important thing that has changed, and the governor has mentioned this, unlike the beginning of this pandemic, when we really didn't know what we were facing, we had no idea the degree to which we could control the spread of this virus, we now know that there is light at the end of this tunnel, especially with the vaccines coming and coming soon. We know, though, that it's not going to be a short tunnel. The vaccine supply is going to be limited for some time. It's going to take time for them to roll out and be made available to everyone, but we know that we can look forward to better days in 2021. But we want to get to that point as quickly and with as many of our fellow Minnesotans not only alive, but healthy as we can. And the way we do that is by doubling down on our efforts to stop the spread of COVID-19 now. If we can continue to do all of these things together, and I too want to join the governor in thanking the Minnesotans who've taken this very much to heart and who have made changes in light of the seriousness of this situation over recent days. And we thank you for that, and we need your continued partnership as we go forward. Thank you very much.
Thank you, Commissioner Malcolm. And to those Minnesotans listening, we've got a room full of professional journalists here. One of the reasons we do this, Commissioner Malcolm every day, myself as often as possible, is to get the information out to Minnesotans to make informed decisions based on what the science and the facts are on the ground. It's their job to take this data and ask questions about it, verify it, make sure that it's correct, so that we can reach some consensus on a agreed upon baseline of truth, a baseline of data, and then make some decisions from that. I just before coming here got off a conference call with several governors, Dr. Fauci, Secretary Azar, and Vice President Pence, dealing with vaccine distribution and where we're at in that. Thinking during sometime in the next week, we will be gathering here to have a very extensive briefing on where Minnesota's at in this process, what's happening, kind of where the direction of the still debate on who's going to get it nationally, what makes sense, what's the distribution look like. But I think it's very important. That data needs to be transparent. It needs to be clear. I candidly would tell you, deeply concerned about some of the mistrust around vaccines. I think we should always be skeptical. I think here in the United States, we have a long, proud reputation of vetting these things, but it's not without a history of some things that have not been great. So I get it that we need to make sure that we're putting out that good information, we're getting it there. This deep dive, and I think we want to take Mondays going forward to try and set that baseline, get updated on it. And again, some of the debates about looking at this data, what did you do about it? And the question would be, as the questions we should be answering is, what changed from week 27 to week 41? What started to change? And we look at that. Well, the weather started to change. We started moving back inside. Case positivity rates in surrounding states started to skyrocket. Mobility amongst Minnesotans started to increase. So there's things that we can look at to show what was there, what changed to bring that curve back down. Those are the questions we're asking. And as the commissioner said, we've gotten better at understanding what works, what doesn't, what the percentage of that what works, how far it's going to move the needle, and what we know that the public will be able to do. And just to be very clear, there's a big difference between setting out a series of recommendation and mandates from the state and compliance with those series of recommendation and mandates, because the ultimate goal here was to slow or stop the spread of COVID until we got to a point where we had a vaccine and could start to protect the most vulnerable and move forward. The good news is we're getting closer to that. The challenging news, it's coming at a time when we are at exactly the worst place in the pandemic. So the desire, I mean, even I'm thinking about things like this. What happens during a series of shots spread out over 2 weeks for the vaccine? Are people going to get that first shot and say, woohoo, I'm out of here? And what happens during that 2 weeks before they get it? What's it going to look like? When do you have immunity? When do the asymptomatic stop spread? Those are all questions that we need the data and the science, and then get that out to Minnesotans. So I want to thank you today for a little patience on this, again, of kind of resetting where we're at to start to dig into what's next. With that, questions? Yes, Dave.
Governor, the bartenders still just sent you a message asking have bars and restaurants cocktails to go. Do you have any inclination to do that?
Yeah, the question was dealing with bars and restaurants. Once again, I would say this, I'm very optimistic. A lot of talks happened over the weekend amongst legislators. The legislative bodies are working. They're working on competing plans, which is good. Take the best ideas from all people, put that into a plan, move that forward. We want to try and provide as much relief. The question was about cocktails to go. This issue around liquor laws and how we get them out, I have to tell you, I'm pretty agnostic on this. Whatever helps folks, I would want to do it. I think carved out a pretty libertarian path about adults make their own choices around these decisions, and they should be, but we need to make sure it's safe. If the legislature can reach some compromise around that, I'm fully supportive of what. I believe, yeah, that's what we're, and I asked our general counsel to look at it because it comes up, but I certainly support them. If that's something the legislature can agree on, we should do that. Just a little. Yeah, the question was the call that with Dr. Fauci, and I have to tell you, I can't state the exact time on this, but my staff who were with me on the call noted this is the first time Dr. Fauci's been on this call for a long time, and I view that as a really good thing. Secretary Azar has been fantastic, and you've heard me say this, and I will continue to say it. I believe the work around the vaccine and the plans around distribution have been incredibly well done. I, for one, and I'll have to get out there and talk to folks about this, I trust the system. What they were talking about was where we were at in terms of Pfizer distributions. The way I understand it now, the first set are landed today in the United States. They're going to do per capita distributions to states. They're leaving it up to states to make some of these decisions. And to just be candid on this, there is a debate even amongst the administration. The Trump administration believes you vaccinate those 65 and older. The CDC, Dr. Fauci and others say you vaccinate the healthcare workers to get the biggest bang for the buck from transmission. Those are discussions that are happening right now, and that was some of the discussion that went on. They talked a little bit about Moderna and Moderna's ability to come right behind Pfizer. We're looking at least on the timeline, they're telling us that Pfizer should be approved for the emergency use authorization, the EUA, 11th of December. Basically is what they're looking at. And I think, again, I don't want to speak out of order, but I believed the state's first distribution of vaccine will be pre-positioned potentially prior to that, with then the state plans being enacted shortly after that to be able to go into effect. That's where we're at right now. We will come here with all of the experts, the folks who are behind this, where the plan looks like within the next week or so to make sure that that's being laid out, but it's being discussed. Of course, most of these vaccinations are going to happen at CVS, in the private sector side of things. The state will set up to make sure that our distribution is there, and then the ethical rollout of who gets it and when they get it. Yeah, Jan, you want to talk about this one? This is the discussion we're in right now.
The state will have a role in customizing the federal the federal recommendations for our state, but we will be getting a framework from the feds and the states have asked for that framework to be as specific as possible in the interest of time. But we're looking at things like, for the state, we'll be able to have some influence over what subset of healthcare workers should be prioritized first. So the federal framework will say, healthcare workers and then this subset of at-risk long-term care residents, for example. But it's hard to say yet before we get the federal framework how much will be left for the state to do, but there will be some customization of that. But we're hoping for pretty specific guidelines, to be honest.
Thank you. I'll second that I think a federal plan is certainly the better way to go. We know that there's been a lot of thought, as I said, over the last better part of several months going into this. Once again, we've seen the problem. I can see this already. If Iowa, South Dakota, Wisconsin, Minnesota all take different tacks on who's getting this, we've got a lot of folks in the healthcare industry that go back and forth across the borders. There needs to be coordination around this. Catherine?
Well, we are expecting to see the impact on cases, starting, as early as a week from now, but more likely in a 2 to 3 week time period. Thanksgiving holiday. One thing, and again, thank you to all the Minnesotans who made adjustments to their plans. That was not an easy thing to do, especially in a year as difficult as this. But for those who did gather, we would obviously urge people to keep close track of their symptoms and consider getting a test 5 to 7 days after you had that gathering as a way of helping to detect any transmission that might have happened, so that people can then isolate and quarantine as appropriate. But in terms of the impact on cases, we look to that in the 1 to 3 week time frame, hospitalizations probably 2 to 4 weeks, and deaths 3 to 4 weeks after that. Yeah, we continue to have discussions about PPE and how much more the state should try to build up in capacity. As you've heard us say before, just the fact that we have a state cache of PPE is something brand new from this pandemic response. How much of it should we be pushing out now versus holding in reserve, and how much more should we be trying to get, are all active points of discussion. We do again expect that the pressure on the hospitals will continue to build in the coming weeks. So anything we can do to keep that rate of growth manageable is so very important in these coming weeks, as you've heard from the frontline providers and the leaders of these systems. And as they've also said, and several of you have asked in prior briefings, well, when do we reach the breaking point? And what they keep reinforcing with us is really there is no breaking point. They will continue to adjust every day, every shift as they need to. But what it does mean is that care that can be deferred, that is less time critical, gets deferred. And that's not good either from the standpoint of other long-term health impacts on the population. So our systems are working just incredibly hard to make the most of the capacity that they have. So it's not like they are ever going to run out of enough capacity to deal with the most urgent cases, but it's going to come at the cost of longer waits, more deferrals, more people needing to be moved to hospitals further away from home. So all things that we want to avoid to the degree possible.
Yeah, it's funny. They would believe I'm worth $400 million, but they don't believe I ran my 8 mile on Thursday morning down Summit and Mississippi River. That's some of this is nothing new. The personal attacks on elected officials. Certainly, I would not claim to be perfect. I try and do the best I can. I was with my family in my home. I've not left the state since March, since this happened. I've spent a night at Camp Ripley watching the artillery, and I spent one night in Duluth visiting small businesses. The thing I worry about with this, I don't worry about me personally. Obviously, if I figured out how to amass $400 million being a geography teacher, I'm probably the right guy for the job because it makes me pretty smart. But that's certainly not how I've lived. I certainly don't diminish anyone for their wealth, but I have lived and done public service, and I'm proud of that, and I was compensated fairly. The thing I most worry about, though, is if you're willing to believe those types of things without any proof, you're probably not going to listen to me when I tell you to wear a mask. You're probably going to, again, I've watched this. There's a whole cottage industry around this that, medical examiners are falsifying certificates around why people died. Or the whole thing was it started with going after Governor Cuomo. People in long-term care facility are not getting COVID for people coming back from the hospital to long-term care. They're getting it from their workers in the community when they stop by to pick up food or something like that. But those types of things undermine the faith in our institutions. They undermine the faith in the system. And I've said this so many times. for the people who want to vote against me, you can find a million reasons that are probably true rather than having to resort to this. And again, when I'm putting out this information, these folks are not validating my position. I'll tell you what, as the governor, the last thing in the world you'd ever want to do is close a business. I'm just telling you, just from a strictly selfish position, you wouldn't want to. But your job as governor is to not do what is politically expedient. It's to do what you believe the science shows is in the best interest of protecting, first and foremost, the health and safety and well-being of Minnesotans. So one of the ways we're trying to do this is continue to bring folks up here. I think, you know, diving into a little bit of the data, bringing in the third-party validators who don't really have, you know, what would be viewed as skin in the game other than they're the ones that are dealing with this and trying to get that information out. So again, and this is where I hope, and I've been a big stickler with this, I worried about this like in Congress, if people lose faith in that. Some of you know this. I pushed the Stock Act, made me very unpopular in Congress, very unpopular. And my colleagues would always say, oh, it's easy for Walz to do this. He's poor. He doesn't care about these stock things that are going out there. No. My point was not that I believe my colleagues were cheating so much, but we need to do everything we can to reassure the public. I can reassure you I was here. I've not traveled. I've not gone out of state. I've not played a single hole of golf. I fished for 2 hours at Farrell Lake on Camp Ripley with my son, and I pheasant hunted in Mankato for one morning. And other than that, I think it's important for me to try and model the behavior I'm asking of you and to understand whether it's my 14-year-old not playing sports, my 19-year-old home because she can't go to college, or us staying, just the four of us, for Thanksgiving here in St. Paul. I need to continue to do that, and I just hope, you know, the vast majority of folks know and will report that accurately. You weren't in Florida either, so.
Esme, I'm not sure if you're asking about personal false reporting or just, yeah. Yep. Yes. Yeah, I think there have been some reports that the case numbers are hugely inflated and the test numbers are hugely inflated because we're going out to do testing, and it doesn't matter what the real result is. We are going to report all the results as positive to make things look worse than they are. And that is, and as a result, people saying, well, don't bother to get tested because the state is cooking the numbers. That's horribly dangerous if it discourages people from getting tested when they need to be tested. And to the governor's point, the undermining of confidence in something as basic as the numbers. If you don't believe these cases are real, if you don't believe the hospitalizations or the deaths are really attributed to COVID, it's awfully hard to solve a problem. So the lack of confidence in the accuracy of the numbers, and particularly around, you know, more recently, just sort of let's not get tested because we can't, the results aren't real anyway, is of deep concern.
What are the flu numbers last year?
You know, that's a great question. I'm sorry I didn't get the flu data before coming over here. We're certainly anticipating and hoping that we have a better flu season because the very same precautions that folks are using for COVID will be extremely important for the flu season as well. Knowing the governor, who often knows the data before I do, I don't know if you happen to know, Governor.
Last week, it was unseasonably low, I would say. And I don't know, again, this is trying to ascribe correlation to something. My guess is that those behaviors that we're exhibiting are slowing the spread of that. And I would mention that the saliva tests that the state gives, the rapid tests, those are both dual. They check for flu and COVID, so they're very helpful. And I would just close out, Esme, on your question. I do think it builds that broader question. If you're able to believe some of these outlandish statements, well, they're just, like I said, that's always, in politics, it kind of always does that. But it seems a little more insidious to me than that. It's the undermining of trust in any of this. And somehow as a country, we've got to get back to this. And again, I'm not going to, I'll open up that other can of worms. It bled itself into election integrity. So don't trust the numbers, the election's not true. Don't trust these numbers, the election's not true. It's very hard to operate a civil society and a democracy if we can't at least agree on the thought, where we're at. It's totally and this is where we should be having this discussion, that the numbers are real, but is there a debate on how we deal with those numbers? Yes, that should be the debate that's happening, not that where the numbers are at. It should be how we deal with them once they're there. So I do think trying to do the best to get that out, trying to help people be good judges of the data that's out there, trying to make sure that it's validated by third-party validators. And again, that's why I would argue that journalism is more important than ever, trying to get back some, and again, early on in this whole thing, undermining the media's ability to report on it was part of this too. So it doesn't worry me personally. You know, I'd have to wear my monocle if it were true, and my top hat. That part doesn't bother me as much as that's just what happens. But it's deeper than that because it goes to undermining the policies. Yeah. Pardon me?
Where the negotiations?
Yes, the question on negotiation for the COVID relief package, a lot of movement, I think, was happening. It was obviously Thanksgiving weekend, but I want to thank the legislators. They worked over this weekend. It's now in the different ideas are being kind of vetted out of what's acceptable. This is pretty normal procedure. We're going to, and my team had an update this morning. I'll get another one tonight of where we're at. And what we'll try and do is combine, because as you might expect, House Democrats and House Republicans have a little different approach to this. Senate Republicans and Senate Democrats have a little different approach. And the package we put out is different than all four of those. So we're at the point right now we're trying to meld them together. It's my hope that sometime, and again, that this process will accelerate itself after tomorrow's budget forecast numbers come out. That will give everyone much better, you know, starting point, if you will, for where we're at fiscally and what we can do in this process. So still trying to get them back. Possibly, yeah, possibly. And I've said once they're ready and once we have an agreement, I'll call them back and we'll get this done. And again, the third-party groups, the hospitality industry is telling us what works right. I think some of it is, for example, are we targeting, how are you targeting business? Because some businesses, golf courses, for example, did better this year than they have in any other year. Do you give a payment to them rather than the small mom and pop, you know, stand, hot dog stand that wasn't able to be at the state fair or whatever it might be? Do we spend a little extra time to be more targeted to get that money to them? I think that's the debate that's happening, some of that. Sure.
Board members that be here, line 3. Now,
Yeah, well, that'll be a decision the courts make. If someone does a stay, they certainly can do that. The question was around line 3, and the final permit on the stormwater runoff was issued this morning. This project has had the most extensive review in Minnesota history. I came into this 4.5 years into about the 6.5-year process. What I said all along is we need to follow the process, we need to follow the law, and we need to follow the science around the replacement of line 3. Those permits were vetted. They've gone to court. They've been put out there. There is an appeal on the certificate of need, which is a complex it sounds pretty simple. Do you need it or not need it? But the law doesn't actually read that way because it applies more to power generating plants than it would a pipeline. With that being said, I certainly, those folks, and this has a lot of passion, both for and opposed to the pipeline, you have to stay in that spot. It's certainly not a governor's a governor should not be one to decide whether it happens or not. My job should be to make sure the process was followed correctly. It stands up in court. At this point in time, I think everything's out there. I think construction will go forward. If the courts choose to issue a stay, we would certainly honor that, but I have not heard that at this time.
Governor, I know this is looking ahead. You talk about the likely indicators and everything. Christmas.
Yeah.
People that are, or should we say today, potential Christmas plans you're going to gather.
So I went from John Lithgow and Footloose to the Grinch in this one. No, the question is a good one. The question is about Christmas and gatherings. I think you're going to see the lags coming in. I do think, you know, and again, anecdotally, what we're seeing, Minnesotans did a pretty good job staying home, but there's some data on movement, especially the airport and others, that show that there was a lot of movement. We'll start to understand exactly what that meant. We'll see where we're at. We will not be into the, obviously, the heart of the vaccine distribution. That will not happen until after the first of the year. So certainly at this point in time, with the data that we have and the trend, and this is again making decisions based on the trends I'm not going to surprise anybody. I think the guidance around Thanksgiving is going to be very similar around Christmas. Again, Jan, you will advise me on that. I start thinking about and preparing that accordingly. Maybe what we learned from Thanksgiving that if we can apply to Christmas of what did work, what didn't work. But I would assume that there would be little reason for me to believe that there's going to be a dramatic change in the trajectory of the virus and the virus spread in the next, little less than 4 weeks. All right. All right. No. Yeah, the question on the vaccine, I was speaking more to the broader population. I still, again, I think it's probably wrong to speculate, but I think at this point in the pandemic, we're trying to lean forward and get information as it's passed from me. The conversation that I just heard with the Vice President and Dr. Fauci and what I'm seeing on the delivery and where we're at in this, I think the potential is once they're given the emergency use authorization and once those arrive here, and if we're in a position to have the protocols in place and being followed, that we will probably start rolling those out prior to that. But I think most Minnesotans need to understand trying to get the number of vaccinations to start to get the immunity and start to get the impact we need, probably going to be into the first to the second quarter of next year, March and April, by the time a lot of that's rolling out. Certainly it will help as more of the vaccines, whether it's Johnson & Johnson or some of these others, come on board, because then you don't have the shortage. I will remind folks again, what's different this time is the financial guarantees that Operation Warp Speed made, it wasn't as if they were right there doing Pfizer's science, but what they did give Pfizer was peace of mind financially that they could start preparing to manufacture simultaneously, where instead of they would have waited, and now on December 11th, if they got a usage authorization, they would have just start building up their capacity. They're already manufacturing. So what that means is that's happening simultaneously. That will start to speed up. I mean, some of the news is amazing. There was a little bit of setback on Pfizer's work. That's good. The system's working. People are catching if there's data errors. But I saw in the Moderna vaccine, and this, I've never seen anybody use 100% on something. They said in their trials, 100% of people, no one got seriously ill. There was a percentage, it was about 95% effective in the efficacy. But if even those 5% that got it, no one required intense hospitalization. That's huge. I mean, that is huge if that can be there. So I still think we'll start to see, and we'll get some clarifications. I'm thinking we're looking at next Monday or Tuesday to try and have a more extensive briefing for the press and for the public of where this is at. Again, this is highly complex in terms of the supply chain, the distribution, the ultra-cold storage, and the private sector that's going to get a lot of these, where folks will just go into their CVS. And again, as I said, we've updated and are preparing for the data crunch that will come with this to make sure that people are getting noted. What did you get on what date, and when do you need the next shot, and how are we going to remind people to get in there and to make sure there's vaccine there? I mean, if you don't get this right, you give the first one, you run out, nobody gets the second one. Those are things in the past we didn't necessarily have to think about in the detail we do here. So again, Minnesotans, thank you. I'll give my one more thanks to you on Thanksgiving for curtailing a little bit, for sacrificing to make sure that your neighbors and those frontline healthcare workers stay safe. Every day we're getting a little closer to the end of this now, and now is not the time to back off. So we'll dig deep here for a few weeks, get through this thing. Thank you all. Thank you, Commissioner.